Because symptoms of kidney disease develop gradually over time, most people are unaware of the problem and seek treatment only when it gets worse. Hello and welcome to the Middle-Aged Encyclopedia. In today's video, we'll look at 8 warning signs of kidney disease. The kidney is an important organ that filters waste products from the metabolic process of our body and discharges them to the outside. The kidneys also help maintain the body's pH balance. Our bodies are neutral by nature, but work hard to keep it in balance so it doesn't become acidic or basic. The heart also contributes to blood health by secreting hormones that stimulate red blood cell production and excreting water through urine production. But is it because it plays such an important role? The kidneys are also silent organs that last until they disappear completely. Because symptoms of kidney disease develop gradually over time, most people are unaware of the problem and seek treatment only when it gets worse. So, from now on, I will tell you about the signs that appear when your kidneys deteriorate so that you can check your kidney health in advance. If any of the symptoms I've listed appear together, you should be concerned about reduced kidney function. Continue to the end for a better understanding of kidney disease. Subscriptions and likes are a great help to make better videos. The first symptom is constant fatigue and lethargy. When kidney function is impaired, the pores that produce red blood cells do not work properly. As a result, there is a lack of red blood cells in the blood. When red blood cells are depleted, the transport of oxygen to each human organ decreases, and toxins and pollutants continue to accumulate in the blood, resulting in fatigue, lethargy, and poor concentration. It can also manifest as extreme mood swings, difficulty remembering previous times, and cognitive dysfunction. Second, it has the potential to cause loss of appetite, indigestion, nausea, and vomiting. Even if the heart's function is reduced by 75%, abnormalities in the heart are rare. There are countless examples. Minor symptoms such as indigestion and malaise may occur, but most people are unaware that they have kidney disease. In this state of neglect, this heart function is reduced by about 90%. It can then be triggered by digestive problems such as nausea, vomiting, and loss of appetite. If the kidney function is not good enough to excrete the waste, vomiting and nausea appear, and the waste stored in the blood is forcibly discharged. If you are lethargic and have symptoms of anorexia and vomiting without a clear cause, you need to see if your kidney function is reduced. Third, there is edema all over the body. Edema can occur when the heart or liver does not function properly or when there is a problem with the thyroid gland, but the most important cause is poor kidney function. The kidneys are a particularly important organ in regulating the water balance in our body. When the kidneys are damaged, there is a problem with urine production, and the amount of water ingested does not go out of the body, so the body begins to harden. When kidney function declines, sodium retention symptoms appear, so swelling mainly appears in the lower part, such as the ankles and calves. Of course, in severe cases, the whole body may enlarge. Please check the condition of my ankles and calves right now. Fourth, your skin can become overly dry and irritated. It is caused by the accumulation of urinary toxins, which are metabolic waste products, due to decreased kidney function. This type of itching is most common on the back, legs, chest, and face and is worse at night than during the day. In particular, dry skin is a symptom reported by 60 to 90% of patients with chronic renal failure. As the sebaceous and sweat glands of the skin atrophy, the secretion of sebum and sweat decreases, and the skin surface becomes extremely dry. As the dryness intensifies, the irritation intensifies. Fifth, bleeding is possible. Brushing your teeth, bleeding gums, frequent nosebleeds, and easy bruising are all symptoms of this condition. Kidney health is closely related to blood health. Bleeding does not stop efficiently and may occur frequently due to poor kidney function, as does the function of platelets and other factors necessary for hemostasis. Sixth, they experience frequent convulsions that do not go away easily. Muscle spasms are usually caused by disorders of the nerves that supply these muscles, so spasms are relieved by massaging the cramped area or stretching the muscles. If there is no movement, spasms come out regularly and movement does not work well, a slight deterioration in kidney function should be suspected. Muscle spasms can occur when the kidneys do not properly control the amount of phosphorus in a state of calcium deficiency, and muscle spasms and paresthesias occur because the spasms are not relieved by stretching or pushing the spasm area. Occasionally, convulsions occur and do not go away even when you sleep. 7th, the urine is cloudy, foamy, and red urine is seen. Even healthy people may have cloudy, foamy urine. However, if you observe this kind of urine regularly, you should think about whether the kidneys are not functioning properly and the protein necessary for the body is leaking into the urine. You may also see red urine if your kidneys are damaged and leak red blood cells and urine. Blood in the urine may indicate a heart stone or infection. Frequent urination at night or bedwetting along with these symptoms could be a sign of kidney disease. This is because the need to urinate may increase due to loss of kidney filtration. If you urinate too much or infrequently, kidney problems should be considered. 8th, you may run out of air. When kidney function is significantly impaired and the body's ability to manage acids and bases is reduced, the body becomes acidic. In this case, the brain is instructed to breathe faster and deeper to maintain the balance we are trying to restore. You may feel short of breath when you exhale too hard to expel more carbon dioxide. As a result, keep in mind that if your kidneys don't function properly, you may be short of breath. Also, when kidney function is impaired so fluid cannot be easily excreted, the membrane surrounding the lungs can fill with water, resulting in pleural effusion. Today, I told you about the symptoms of kidney failure. First, there was constant fatigue and lethargy. Second, indigestion, anorexia, nausea, vomiting. Third, edema due to improper drainage. Fourth, itching and dry skin caused by atrophy of the sebaceous glands. Fifth, it is a symptom of bleeding gums, runny nose, and easy bruising. Sixth, spasm and relaxation. Seventh, foamy urine and urine with a reddish tint. Eighth, shortness of breath. The symptoms I've described are all so familiar and blurry that you can easily ignore them. However, if these symptoms appear together, please go to the hospital right away and get a kidney function test. Never ignore the cry of the kidneys who are still working hard. Subscribe to our channel for more informative videos like this one. Thanks for watching the video.